directly to the substance. So Professor Gregory Ninot, as I briefly said, you have coordinated all the work towards the creation of an NPI registry in France. And among others, because it's there's a long list, but you are Associate Director of the Debré Institute in Montpellier. This is the Institute of Epidemiology and Public Health, member of the Institut Universitaire de France, research manager at the Montpellier Cancer Institute. And yes, please.
Hello, everybody. Thank you very much, Cécile. Yes, I'm from Montpellier, south of France. Maybe you know this town. It's especially a town from the Faculty of Medicine, the oldest Faculty of Medicine in Europe. And yeah, we have a long past of collaborative research, interdisciplinary research. That's probably the reason why NPI, non-pharmacological intervention, can be so developed. The first aspect is when you use PubMed and just try non-pharmacological intervention. The first publication was in 1975. So it's not old, it's a little bit recent. And as you can see, the number of publications increased around 20, the beginning of the century. The word is also used by World Health Organization 2003, especially for the compliance and the disease management program to improve the use of drugs. So it's not, and Cécile talked about, it's not alternative medicine. It's a kind of combination to improve the quality of the use of drugs or maybe a medical device. You can see here in France, 2011, a big publication, a big report mentioning that we have to improve, to increase the research on non-pharmacological intervention, because it's not really clear how we can validate some NPIs. We have also, more recently, because probably of the COVID and the perspective that some NPIs could be useful against COVID. So it was 2020 with this big European Center for Disease Prevention and Control. More recently, the European Commission wrote a text 2022 about a non-pharmacological intervention, non-pharmaceutical intervention, but it's the same word. And of course, to improve the research, to increase the number of researchers working on this topic. But maybe here in the room, or maybe in the Zoom, when you talk about or think about NPI, what is NPI? Surgery, medical device, supportive care, psychosocial intervention, everything is NPI. Maybe architectural organization could be non-pharmacological intervention. So it's not really clear. We don't have any agreed definition about NPI, but not with a book, publicité. So in this book, I found 100 equivalent, something synonym. It's too much. What is really intervention, NPIs? This notion have to be more clear, especially in healthcare settings, discipline, and also profession. What about the framework, validation framework? When one of my PhD students published these papers 5 years ago, we obtained 46 paradigm model assessing NPIs. When you are a researcher in drug, you have only one model of validation. one model of research only for the drugs. But for non-pharmacological intervention, you have 46 model framework. It's not possible because you can have a lot of misunderstanding between the result and between the use of this kind of practice. And the consequence of this lack is, of course, a low transferability from research to practice. And some researchers publish or design a new study to prove something with a very high level of evidence-based. Or in the opposite, you can say, oh, it is absolutely validated, and you can use this kind of practice without any evidence. It's not qualified, it's not codified, so the traceability in the healthcare path are not very clear. So it's really difficult. You can have a number of physiotherapist sessions. You can have a number of neuro or psychologist sessions, nutritionist, nurse, etc. But no, what is the content? No information about the content, no traceability. So no, the possibility of the use with, for example, artificial intelligence to have a traceability of this kind of intervention. And last but not least, not enough continuous improvements. So the conclusion, especially for the press, you talk about that, Cécile, one of the conclusions is that every healthcare professional create a new NPIs with a physiopathological model and some techniques. And they create their own intervention without have real knowledge of maybe a lot of research about this kind of NPIs. And some journalists say, oh, whatever the content, the only effect on health is the relationship, is the alliance between a patient and between a professional. So every content are the same, but no, it's absolutely, it's only a belief. And the risk, and this paper is particularly probably dangerous to propose two approaches of medicine and especially care. You have on your right, conventional medicine, only surgery, only radiotherapy, only drugs. And so it's biomedical domain. And in the other hand, you have a parallelism, another way for care and prevention. And it's only for traditional medicine without any research or just to have some information about the patient experience without any research. And it could be probably dangerous in several countries to have two approaches of medicine without any communication. And no, in conventional medicine, you can have also NPIs and evidence-based NPIs. That's why we have designed a 2 years participative study in France, co-designing a multidisciplinary, intercultural, transpartisan scientific framework specific to NPIs with all the relevant stakeholders, with a long way to conclude about this model. It's called NPIs model. More than 1,000 participants to identify the evidence-based recommendation invariance, methodological and ethical invariance, with a session dedicated to improve the invariance. And after I have a vote for a lot of people, and after the contribution of the health authorities, agencies, scientific societies for 4 months. And last but not least, the restitution for scientific society, health authorities. You can see here the Ministry of Health, Senate, National Authority for Health, health insurance, another insurance for elderly people, public health France, and last but not least, Academy of Medicine in France to expose the model. And we have now the opportunity to have only a model, and we have a lot of support, for example, in CERM or ANCA, Cancer National Institute in France. And we have now 31 scientific society, French scientific society, neurology, cardiology, public health, endocrinology, etc. A lot of scientific societies say, okay, this is a only consensual model, and we can design some study to show evidence of the non-pharmacological intervention. So to be clear, the first aspect of our study was to clarify and to define what is NPI. It's evidence-based, effective, of course, efficacy and study, personalized. So it's not only a remedy. You have to adjust for the context. Non-invasive, it's not surgery. Health prevention or care protocol. It's a protocol with a beginning and the end. It's not a way of life. It's not a, it's really a moment of prevention, a starter moment to change something for the person. Another aspect is register and supervision by a qualified professional. So it's not an opposition with medical device or drug. It's not an opposition to health recommendation or public health recommendation. It's not in opposition to environmental recommendation or strategy, but it's more dedicated to a person of or a group of persons, and with 3 domains: psychosocial domain, for example, diet, targeted diet, physical domain, for example, manual therapy or physiotherapy protocols, and also the aspect of psychosocial, neuropsychology, intervention, psychotherapy, or disease management program dedicated to a specific health condition. The recommendation, the model, as you can maybe remember the phase model for the drug, this is a model. We underline the need of mechanistic studies, the need also of intervention study, and a specific prototype study to describe very precisely what is the intervention. It's not only a number of sessions of a physiotherapist, but a really description of all the content or the context of the intervention, you know. After the intervention study, also the implementation study, because in Europe, it's not only, it's not obvious that it's efficient in Belgium, professor, but maybe it's not efficient in Spain or in Switzerland or another country, or from China to Europe. It's not really obvious. We have to also design in this kind of protocol implementation study to identify the best practice for this intervention. Okay, so this is recommendation, and now with the group, we think about the NPI development process, because with a drug, you have a register in each country. But for NPI, we don't have any register for, but it's possible with research after submission, approval. You want to make research on NPS. approval, integration, dissemination, improvement of this intervention. And that's why we identify some characteristics of this NPI. First, it's fully described with more than one prototype study, explainable also with a mechanism. It's not only something spiritual. It's really identify mechanism of action. It's also effective with two intervention studies with measuring efficiency, effectiveness, but also risk. And not because you have a lot of papers in research only pointing the benefits and not the risk. Another aspect is, of course, the safe and safety. And the last but not least, implementation, how we can have some best practice to integrate. So we can create a card describing extensively each NPI. Example, you have the WHO, the recommendation about fall prevention. It's very, very, very expensive for each state. And you have a very, very famous person in New Zealand working and publishing and identify a program, Otago method. They can decrease the risk of fall and also the risk of hospitalization. And you have also, you can earn money. You have also in brain disease care, a very famous intervention called cognitive stimulation therapy, 7 weeks, 14 sessions, 5 to 8 persons with a psychologist or a nurse. And we have also evidence-based that it's really efficient. But in some countries, especially in France, we don't really know and apply this kind of intervention. Another example is about the oral drug management during cancer treatment. It's very expensive, but a lot of patients don't use really the good drug. And this researcher published a program identifying free session, one by a pharmacist, and free phone calls, and improve significantly the observance, the compliance, and also reduce the toxicity, side effects, decrease the risk of death, and also improve quality of life. Last but not least, another example in children or adolescents with attention deficit hyperactivity disorder. And you have also a very famous program. It's a CBT, cognitive behavioral therapy, dedicated to this child with a very, very important efficient for this program. So to be concrete, it's really possible to organize right now a register in Europe, for example, with the opportunity to identify health condition, think about what kind of NPI could be used, and implement with a traceability. That's why we can create this register of a codified, applicable, traceable, and fundable NPI record. They can assess precisely by public health and by healthcare professional with possible feedback. And because of the support of several organizations in France, we have launched 2 months ago in Paris the NPI registry. It's an initiative, of course, it's the beginning of the story. It's open, it's free for the user in 2 languages right now you can use, and we can complete, of course, the registry by several cards. We have a lot of partners. Assurance maladie, it's a very important health insurance, Ligue contre le cancer, and also a private company. But we have a lot of support also of organization, especially organization of passion and also organization of professionals. So thank you very much for this support. We have several positive impacts, of course, health, positive impact also, the NPI on society, because we can create some proximal jobs for patients. Also, we can decrease, especially hospitalization for a lot of patients. And last but not least, maybe reduce also the transportation between hospital and also a lot of transplantation, because it's already a virtuous circle. Thank you very much for your attention.